causes back pain? Before I talk about that, I just want a quick overview of normal anatomy of the spine. So, as you look sideways onto the spine, you'll see that it's not straight up and down. There are natural curves within the spine, and there are good reasons for that. When mankind stood up on two legs, if you think most animals are on four legs, mankind is up on two legs. As soon as we did that, we put compression and compressive forces down through the spine. And to compensate for that compression, we've got these natural curves that help with shock absorption. So in the lumbar spine, we have the coccyx, which is the tailbone, the sacrum, the 5 lumbar vertebrae, 12 thoracic, and 7 cervical. If we look sideways on, you can see in the lumbar spine it curves in, that's a lordosis. In the thoracic spine it curves out, and in the cervical spine it comes back in again. In order to maintain good posture, you need to have those curves in a neutral position. So in other words, you don't want too much lordosis or too much kyphosis here, you don't want a pokey chin. So maintaining good posture is very important for preventing back pain. Now, if you don't maintain good posture, if you look at our screen here, this is an example of poor posture. So this image on the left, somebody's sitting, slumped at a desk, hunched over, they've got chin protrusion, they've lost the natural curves in the spine, it's just a C shape here. And as they're sitting there, the angle here is only 50 degrees as opposed to 90 degrees, which you would want with somebody who's seated in a good position. Now, the reason that's significant is because if somebody has poor posture, it's going to put a lot of stress and strain on their ligaments. So if I just get Edith to step back a moment. So if as you watch this video you hold your finger back, what you'll find is after a short period of time is it starts to ache, and the reason for that is that the ligaments at the front of the joint are on a stretch and they want to be relieved of that pressure. And exactly the same thing will happen in the spine on here. If it's in a poor position, as per the image you just saw, the ligaments will be on a stretch and they will start to ache very quickly. The other image on our screen here is of a sway back. So in this image, there's an exaggeration of the lumbar spine lordosis and an exaggeration of the kyphosis in the thoracic spine with chin protrusion. And this commonly happens for people who have basically lazy stomach muscles. So his stomach muscles here aren't holding his spine up, his core muscles aren't holding him upright, resulting with compensation throughout the whole system. So his pelvis tips forwards, that increases the lumbar lordosis with the increased thoracic kyphosis, and you have to have more chin protrusion as a result of that. And yeah, sorry, you just step back again. So any poor posture will lead to back pain, although if you did a scan or an x-ray on someone whose pain was purely due to poor posture, it probably wouldn't show a great deal, other than their poor posture if they're in standing when they do the scan, but generally speaking people aren't standing, they're lying. So you could be in quite a lot of pain due to poor posture without there actually being any obvious damage. The next cause of back pain is discogenic, and this is what people often refer to this as a slipped disc. So I'm just going to explain what that means exactly. So between each vertebrae you have a disc, like so. I just draw a vertebrae. So the vertebrae is the bone. So between each vertebrae you have an intervertebral disc in here. Okay, so that's looking from front to back. This is a cross section of that intervertebral disc. Now, the middle of that disc is a gelatinous material, and it's surrounded by a ligamentous sort of annular circle around a more soft jellified centre. Now if you get yourself into a poor position, and a good example of this is flexion rotation, so I often see people who they bend forwards, they twist, and they lift something heavy, and what happens is they put a lot of pressure on this intervertebral disc, and depending on the direction of their movement, the soft centre, it bulges out through like so. It pushes through the annular rings, causing a bulge in the disc. So on front to back view, you'd have a bulge coming out like so. And that can be extremely painful. On the skeleton here next to Edith, we've got an image of that. So here are your intervertebral discs, and just as an example, if Edith can see that, they've just put a little bulge on there. Now depending where the bulge is will determine how much pain you experience. So if that bulge is pressing onto a nerve root, these are the nerve roots here coming out, might be in the wrong position, but they come out here. If that presses onto a nerve root, then that's going to cause you a lot of pain along the length of that nerve root. That's probably quite a severe situation. Even worse is if the bulge is pressing centrally onto the spinal cord, and that can lead to something called cauda equina, where you get problems with your bladder and bowel, and that's quite a serious sign and needs surgical decompression. The best scenario is if that bulge here is not pressing on a nerve and it's just simply bulging out into a sort of an empty space, and that will cause you severe back pain, but it's not going to be causing sciatica or cauda equina type symptoms. On our computer here, we've got an image. So this is a normal sort of a disc, and then this one here just shows a herniated disc. This particular image is onto a nerve root. If it came back here onto the spinal cord, that would lead to something called cauda equina. That would need decompressing. The best, if you're going to have a disc bulge, the best sort would be laterally here, so it's not pressing on a nerve root or the spinal cord. The next cause of pain, or back pain, I mean, there are other causes, by the way, but what we're concentrating on in this video series, I'm covering here. The other causes we're not covering. So the other cause of back pain is degenerative. So as we get older, the discs dehydrate. So the intervertebral disc dehydrate here, and it actually starts to get narrower. As it gets narrower, it starts to put pressure on the facet joints on the side of the spine. As that pressure builds over the years, they start to wear down, and you get arthritis. That's wearing down of the joint surface and the facet joints, and you can get lipping of the vertebrae. It is a natural aging process. It's going to happen to all of us as we get older, but for some people that can be accelerated, and for other people it's not such a problem, and this can lead to a lot of pain. Likewise, for some people, they can have quite a lot of spondylosis, very little pain. So I've got another image here just to illustrate what I've just been talking about. So in this image, the intervertebral discs are almost completely gone. There's very little gap between the vertebrae. There's lipping of the vertebrae here, and that happens because the pressure on the bony surface has increased, and therefore the body's very clever. It will produce extra bone to compensate for the increased pressure, and the facet joints at the back of the spine also, you get hypertrophy of those joints and arthritis basically within those joints. So those are the three muscle, nerve, joint causes of back pain, and those are the 3 types of back pain that this video series is going to be addressing. Thank you for watching.